Ontario's 29,000 practicing doctors have not liked what they've heard from the Ministry of Health for quite some time. Negotiations with the province broke down 15 months ago, and it's been very rocky ever since. We heard from the minister, now let's hear from the doctors. Dr. Ved Tandan is past president of the Ontario Medical Association. He's a practicing surgeon from Hamilton, and he joins us now for more. Here's what your current president has had to say about all of this in a letter to the Minister of Health. He says, while Ontario's doctors are eager to secure an agreement, it would be irresponsible to our patients to accept anything less than a permanent and stable framework, which includes long-term binding arbitration. Minister wants you back at the table. He has said binding arbitration is on the table for discussion. So why aren't we back at the table talking?
You know, Steve, what's missing in all the conversation that's happened back and forth over the last week or so is the patient. I want to stop and talk about that just for a minute. You know, as you said, I'm a practicing surgeon, and every day when I go to work, that's what I think about, is putting my patients first. And I know the other 29,000 practicing doctors in Ontario do the same thing every day. And, you know, we've been asking for binding arbitration now for a year. It's really important to us that the minister understands why we need binding arbitration. So I'm encouraged that we're now seeing a glimmer of hope over the past week, and the minister's saying that he's willing to talk about binding arbitration.
That's progress, isn't it?
It's progress, but I think it's really important that the viewers understand what we mean. And that is that we need to agree to the terms of binding arbitration and the rules before we get back to formal negotiations.
Well, that's not what he's offered.
I know that, but to do otherwise would be like starting a baseball game and playing the first inning before you decide whether or not you're going to have an umpire, or whether the home team gets to make all the decisions, and what are the rules of the game. It wouldn't make sense to anybody. So we have to have those rules decided on and agreed to before we can get into formal negotiations. And once they are agreed to, we're ready to resume those negotiations immediately.
Let me understand this. Unless the minister, in your view, agrees to binding arbitration to settle this dispute, you will not come back to the table.
So that's the basis of our legal challenge right now, Steve. As you know, the Supreme Court in January of last year issued 3 rulings that substantially changed the legal landscape. And that really says to us that groups like physicians who don't have the ability to strike, who do not have the ability to strike, need to have some sort of a binding dispute resolution mechanism, like binding arbitration, to fix the power imbalance between physicians and government in negotiations. So we've tried to do it the other way. In 2012, we went to negotiate, and the government then proceeded to unilaterally impose their will. In 2014, we negotiated for a year, and at the end of that, the government presented us an offer, and they said, this is our final offer, take it or we'll impose it anyway.
Which they did.
Which they did. So that process clearly does not work, and with that process, we are now 2 years without a physician services agreement, and really without the ability for doctors and government to work together for what we're supposed to be doing, which is to improve the healthcare system for our patients.
I get that, but before you do that, I understand this is both a financial story and a public relations story. And the public relations aspect of it went back to a week ago today when the minister had his press conference, at which he rolled out a lot of numbers, including who the high billers are and all this kind of stuff. What did you think about that press conference?
So, you know, I have to say I was disappointed that the minister has taken the opportunity to use the situation that we're in and take a very divisive approach with our profession.
Did you think he was trying to humiliate you?
It certainly seemed like that, and it certainly seemed like he was trying to divide the profession. And, you know, that type of approach, again, we're here to talk about patients, to improve care for our patients, and that's what we're trying to do. But taking shots like that, which is getting him lots of headlines, isn't helpful for getting us back to the table and isn't helpful for our patients.
Here is the problem as he's identified it, and then I'll get your feedback on this. Lots of doctors are general practitioners, and then others are surgeons. And he says there's an imbalance in the way you're paid. The GPs don't make enough, the surgeons and the specialists get paid way too much. Would you agree that's an issue?
You know, I'm going to take you back to last year, if I can, Steve. And it's really interesting that the minister started to make these comments. And again, I think it's not done for the reasons he's outlined, but it's done to divide the profession. But in 2015, in April, the government introduced unilateral action, as you know. And what's really interesting is if the minister felt that family doctors were underpaid and specialists were overpaid, I'm not sure why the vast majority of those cuts, the $700 million that they cut from physician services, the vast majority was targeted at family doctors, and particularly targeted at new family doctors entering the system.
That made no sense to you?
It makes no sense at all, if that's what he's saying.
So my hunch is, I'm going to put this on the record, then you tell me what you think, okay? My hunch is there's a big fight inside the Ontario Medical Association right now, which represents all of the doctors, both the GPs and the specialists. And it's a really tough political nut for you guys to crack, to go into a set of negotiations and negotiate away gains that the specialists have made over the years in hopes of helping the GPs do better. And sometimes, sometimes labor groups, as the OMA I guess in this case is, just want the government to bring down the hammer and do the dirty work for them. Would you like that?
So, Steve, I first off say that there's not a huge divide in the OMA. Our profession is united on this. And we actually have a policy and a process in place to address this issue called relativity. And we've been doing it over a number of years. So each year we look at making adjustments to the physicians that are on the higher end of the income threshold and those that are on the lower end, and try and bring them back to the average level. So this is something that we believe in, that we've worked on with government over the years. We've made adjustments when we had a relationship with government. We've made adjustments to fees. I think the minister alluded to it earlier. The cataract fee was reduced, and that was done bilaterally with the OMA and the government to make those kind of adjustments. So we agree with that process, and we've been working on it for a number of years. But it's not something that can be done immediately or drastically, and it has to be done together, because what we cannot have happen is changes made to the way physicians are remunerated or the way we deliver care that has unintended consequences that could either decrease the quality or the access of care that our patients need and deserve.
If part of the game, though, is to get if part of the goal here is to get cost certainty for the Ministry of Health, which needs to, when it budgets this much for doctor compensation, it can't at the end of the year say, oh my goodness, we actually spent $200 million more on this, we didn't have that budgeted. So they need that kind of cost certainty. To get that, would it make sense to put all of Ontario's doctors on salary?
Steve, it's something that we would talk about. It's a complicated issue. There are a number of doctors already in the province that are on salary, but the vast majority of doctors are not. And the vast majority of doctors operate a small business. I think many of our members would be really happy with the idea of being put on salary, because that would mean the government would then assume the risk of managing the office lease expenses and the staff salaries and benefits and the medical supplies and the equipment that you alluded to in your interview with the minister that doctors currently purchase. And those doctors would get the other benefits that salaried employees have, like pensions and benefits and paid vacations. But again, making major changes like that has to be done together, something that we would be willing to talk with the ministry about. And it would probably, one size does not fit all. But we again have to make sure that we cannot do something that has a unintended consequence. It changes the way people deliver services in ways that we hadn't thought about. And that's why government cannot and should not do that alone. And we need to work together. But in order to get there, we have to get to a negotiating table and get a physician services agreement. And whether we do this through negotiations or through the implementation of an agreement over the next number of years when we have a relationship again, I think that work needs to be done on modernizing the way we pay physicians. And we've been doing that for the last decade.
A lot of rumors about a cabinet shuffle coming up at the end of June when the House rises. Would the negotiations be advanced if Eric Hoskins, in your view, were shuffled out of his position?
The OMA negotiates with the Ministry of Health. And we'll work with the minister and do the best we can to achieve an agreement. So we'll work with whatever minister the government chooses to put there, and we've worked with a number over the years.
Would you prefer this guy were out, though?
Dr. Hoskins is a physician, and he's the Minister of Health, and we are trying our best to work with the current minister.
Do you find it ironic that the Minister of Health and the Deputy Minister of Health are both medical doctors? I'm not sure that's ever happened before in the history of the province of Ontario. And yet relations between the group that represents Ontario's doctors and the ministry have never been worse. How do you figure that?
So I think that relationship issue goes back a long time now. It probably goes back at least to 2012. So I'm not sure there's a relationship between the two. We had a very difficult negotiation in 2012, followed by unilateral action, and a very brief period following an agreement that had some significant cuts for physicians, as you know. So I think it's more of a sign of the environment that we're in. The government's in a really difficult fiscal situation and has been for a number of years. One of the things that's encouraging to us is that recent upgrade from Moody's on the province's fiscal situation. Mm-hmm. So we're hopeful that when we get back to the table, the government's going to come with a more reasonable position. And we're really hopeful that when we come to the table knowing that there is an arbitrator there to fall back on, that both parties will be more reasonable in their positions and come to a negotiated agreement, and that we never actually need to use an arbitrator.
Tell me this, how much does it grind the gears of doctors when they see the kinds of expenditures that are being spent by the Ministry of Health on local health integration networks, on community care access centers, on the quite significant bureaucracy that is in place to keep this healthcare system afloat right now, and yet they're coming after you for money?
So doctors are frustrated and they feel disrespected at the way the government has chosen to vilify doctors and suggest that by providing care to our patients and then billing the system as we're supposed to, excuse me, that we're somehow doing something wrong. But the government does need to fund the infrastructure for healthcare and fund the system, and we know that and expect that. But they need to have the resources. That's their responsibility as government, to have the resources to fund the system that our patients and our people expect and deserve.
Do you think docs are going to leave Ontario if this persists?
You know, Steve, there's a saying that those that ignore history are doomed to repeat it. We've been here before. In the 1990s, we were in a very similar situation, and we saw the impact. We saw doctors leaving the province in droves, and it took us 10 years to recover from that. So there's a real risk that the same thing will happen again. We've seen it already. New family doctors who cannot get into family health teams, which is the model that they're trained in, are looking to other jurisdictions.
Let's finish up on this, Dr. Tandan. You are asking the minister to put into place, before negotiations have even started, you're asking him to agree to binding arbitration before you even come back to the table. In essence, I appreciate your position that you're saying we can't play a game in which we don't even know what the rules are ahead of the game. Do you appreciate his position, which is, I can't consent to binding arbitration when it could cost me an extra $300 million in salaries, without my having any influence over the process at all? Do you see his position?
So, Steve, we're not asking the minister through the media to agree to binding arbitration and on radio or television or in the newspapers and then come to the table. We're asking to sit down and talk about the process for binding arbitration and agree to a process that both parties can accept. But at the end of the day, we do have to have a fair process, and one that respects the constitutional rights of doctors, but more importantly, one that allows doctors to advocate on behalf of their patients at the table to make sure that decisions that are made are in the best interest of patients. And that's what we've tried to do in every negotiation. We have a history of doing that through negotiations, and a great example of that is the after effects of the 1990s debacle, when we got together with government and we recognized that family medicine in Ontario was almost dying, and we had to change that, and we created primary care reform. And that was done through negotiations with government, a whole new model for care for patients in primary care. And then we went from 3 million patients who did not have a family doctor, and now we have 800,000. Still too many, but huge improvements, and that was because we worked together with government.
Understood. Dr. Tandan, it's good of you to come into TVO tonight and share your views. Thanks very much.
Thank you.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.